Welcome to What's Now. I'm your host, Christine Napier. This is a show where we find out what's trending. We talk about current research as well as products that you don't want to miss out on and much, much more. Today's show, we are primarily focusing on your health and also Earth Day. Up first, we're going to deep dive into Parkinson's disease and some of the new research there, specifically around deep brain stimulation. Let's find out more.
It is estimated that 1 in 15 people in the U.S. will receive a diagnosis of Parkinson's disease in their lifetime, often causing symptoms of loss of movement, control-like shaking, slowed movement, and stiffness. But a high-tech therapy known as deep brain stimulation can offer relief for many patients. Joining us now during Parkinson's Awareness Month is Dr. Shahed from the Icahn School of Medicine at Mount Sinai, along with Jeff, who she treats for Parkinson's disease. Welcome both of you to Park City Television.
Thanks for having us.
Thank you.
Dr. Shahed, what is Parkinson's disease and what are the symptoms?
Yeah, so Parkinson's disease is a brain disorder. It's a neurologic condition that unfortunately can be progressive over time. And the main symptoms that it causes for patients are related to movement, as you mentioned. So people might have things like tremor, stiffness of their muscles, slowness of their movements, and difficulty with walking and balance. And the real challenge here is that these symptoms can start to affect people's ability to get through their day and kind of perform their routine daily activities. So things like just walking around the house or getting dressed in the morning, even sitting down to enjoy a meal, these can all become increasingly difficult as time goes on. So Jeff and I are happy to be here today joining forces with Medtronic to raise awareness about this condition and talk about some of the treatments that are available. And that's really the good news. We have, and even though we don't have a cure for Parkinson's disease, there are a number of different medications and also some surgical treatment options that can help control those symptoms and improve quality of life for people living with this disease.
Jeff, what are some of the major challenges that you face related to Parkinson's?
Well, I was a dentist for over 40 years, and when the meds that they gave me did not work, I was forced to retire. I had a lot of stress. I had a lot of dystonia, which is problems with movements, and then I decided to take it into my own hands. I looked up on the internet, I found DBS, and I went to Dr. Shahed.
Dr. Shahed, what is deep brain stimulation and how does it help people with Parkinson's?
Yeah, so deep brain stimulation, or DBS as we call it, is a surgical treatment for Parkinson's disease. We usually recommend it to our patients once they have been taking medications for a period of time and they're not really getting the relief that they need to get their symptoms controlled and be able to function through their day. And the way that DBS works, it's kind of like a pacemaker. So patients have a battery that's implanted into the chest. The battery is connected to a brain electrode that's implanted into the deep brain structures that control movement. And when we program the device, it delivers a small electrical current into those deep brain structures to really kind of try to block the signals that are associated with the symptoms, like the tremor and the stiffness and slowness. And it's really amazing to see how quickly symptoms can respond to that. Just by turning the stimulator on, you can see things like tremor and stiffness sort of melt away. And Jeff was really no exception to that. He had a fantastic response. But I do want to say that although there are many people like Jeff who can have a good response, it's not for everybody. And so people who are interested in DBS should talk to their doctor, understand the risks and benefits, and find out if it's right for them.
Jeff, specifically, how has deep brain stimulation helped you?
Interesting, this tremor and the stiffness have gone away totally. You could see from my hand that I'm not shaking anymore. I could see and play with my 4 grandchildren, play golf where I never used to, and even make coffee for my wife in the morning without spilling it.
And Dr. Shahed, where can we get more information and learn if DBS is right for us or a loved one?
Yeah, you can go to the website discoverdbs.com to find out more information about DBS and to get connected with a movement disorder specialist who has experience treating this condition.
Thank you so much, Dr. Shahed and Jeff, for joining us today. I really appreciate this information about Parkinson's and deep brain stimulation. And Jeff, I really appreciate your openness about your struggles with Parkinson's.
Thank you.
Thank you.